How does wavelength impact laser pigmentation treatment? Imagine using a laser to target stubborn spots on your skin. The secret lies in the wavelength of the laser light, which acts like a precise key fitting into a lock. The wavelength determines how deeply the light penetrates your skin and how selectively it targets the pigment causing pigmentation issues. Different wavelengths are absorbed differently by melanin, the pigment that gives skin its color, and other skin components. This absorption pattern influences how effective and safe the treatment will be. The principle behind laser pigmentation treatment is called selective photothermolysis. It means the laser is designed to deliver just enough energy at a specific wavelength to break down the pigment without harming surrounding tissue. The pulse duration of the laser also matters because it helps confine the energy to the target area, reducing the risk of damage elsewhere. Most lasers used for pigmentation work within a wavelength range of about 630 to 1100 nanometers. Within this range, there's a good balance between how well the laser targets melanin and how deeply it can reach into the skin. Shorter wavelengths, less than 600 nanometers, are absorbed more superficially, making them suitable for surface-level pigmentation like sunspots or superficial melasma. They requiring less energy but don't reach deeper layers. Longer wavelengths, over 600 nanometers, penetrate further into the dermis, which is helpful for deeper pigmentation like dermal melasma or certain types of tattoos. However, because they are absorbed less by melanin, they often need higher energy levels to be effective. For example, lasers emitting around 530 nanometers, which is green light, are good for superficial pigmented lesions and vascular issues but don't penetrate very deeply. The ruby and alexandrite lasers operate around 690 to 755 nanometers and are effective for superficial to mid-depth pigmentation, including some tattoos and melasma. The YAG laser, which emits at 1060 nanometers, penetrates the deepest and is often used for darker skin types or deeper pigmentation because it is less absorbed by epidermal melanin, reducing the risk of side effects like hyperpigmentation. Safety is an important consideration. Longer wavelengths tend to cause fewer side effects, especially in darker skin, because they spare the epidermal melanin more effectively. They also requiring higher energy levels to destroy pigment, which is why proper calibration by a trained professional is essential. Advances like picosecond lasers, which deliver ultra-short pulses at wavelengths between 530 to 1060 nanometers, improve pigment removal by fragmenting pigment particles more efficiently and with less heat damage, leading to fewer side effects and better results. In plastic surgery, choosing the right wavelength depends on the type of pigmentation, its depth, and the patient's skin type. For superficial issues like sunspots or melasma, shorter wavelengths or broad-spectrum intense pulsed light may be used. For deeper pigmentation or tattoo removal, longer wavelengths like 1060 nanometers or picosecond lasers are preferred. The goal is to maximize effectiveness while minimizing risks, ensuring a safe and satisfying outcome. In summary, wavelength impacts laser pigmentation treatment by controlling how deep the laser penetrates, how well it targets melanin, and the safety profile. Selecting the correct wavelength based on the specific pigmentation and skin type is crucial for achieving the best results. Always consult a qualified healthcare professional to determine the most appropriate treatment plan tailored to your individual needs.